arms 2 shades darker than your face, a watch mark, a sleeve line, a neck that doesn't match your chest. If you live in India, you exactly know what I'm talking about: tanning. And here's what frustrates me as a dermatologist. A lot of people use random detan masks, they use some home remedies and actually think, why is it not working? Today, as a dermatologist, let me explain you what we can actually do for body tanning. Hi, this is Dr. Ravali Yalamanchili, Chief Dermatologist at Neya Dermatology and Aesthetics. In India, we Indians are melanin rich and are brown skinned individuals. So the chances of tanning are much more. Just like your face, your body also tends to tan. Most commonly, a lot of people use sunscreen, skin lightening agents or various skincare products on their face, and they usually leave behind the body parts. So someone who is chronically exposed to sun, or who is randomly going out in the sun too much, playing a sport, or in a regular commute between work and office in their cars, these exposed areas, since there's no protection, usually your arms, your neck, and also sometimes even your feet tend to get darker because of tanning. So let's talk about what actually works for your body tanning. I know it's too much to have a big skincare routine even for your body, but let's keep it simple. Number 1, using a sunscreen. That's the only preventive method you can follow to actually stop tanning. If you're someone who's using a sunscreen regularly for these areas, the chances of tanning are less. And number 2, physical protection. Let's say you're constantly outdoors, you're someone who's going on a bike or someone who's playing a sport in the sun for very long hours. Not just sunscreen, physically protecting these areas by using a hat, a cap, or even full hand sleeves or UV protection gloves will help you in a long run. And number 3, gentle actives. Please understand that some of the skin lightening agents like glycolic acid work wonders when it comes to the treatment of body tanning. You can talk to your dermatologist, see what is the right concentration in your scenario and start using it on an everyday basis. Tanning is different in different individuals. Some people, they stand in sun for long hours, they do not tan. For some people, even though when they're outdoors only for like 10 to 15 minutes, they tan badly. This varies from person to person. If you're someone who has stubborn tan, not responding to any home remedies, not responding to the basic precautions, and not responding to any topical agents, you can opt in for some in-clinic procedures. So when it comes to the in-clinic procedures, we have 2 gold standard procedures that help in treating tan. Number 1 is chemical peels and number 2 is Q-switch and DAG laser. Chemical peels work wonders. You might need a couple of sessions, at least 4 to 6 depending on the severity of tan, but most of the peels might have some downtime where there is visible of tanning. My personal favorite are to use glycolic acid, TCO or different combinations of peels. And when it comes to a Q-switch laser, there is no downtime, but in men it can bleach the hair, so we might end up shaving this hair in this area. So when you do a Q-switch laser, very similarly, it targets the melanin, your tanning will reduce and you might need typically 6 to 8 sessions. So there are some of these conditions which look like tan but are not actually tan. In the initial stages, conditions like macular amyloidosis or even some conditions like lichen planus pigmentosis just look like faint brown or grayish pigmentation on your hands. So you need to differentiate it from regular tan. Please visit a qualified dermatologist, understand what is that you actually have, and then you start treating the condition. So to summarize, tanning is just sun damage. Very simple protocol to follow here is a good sunscreen. It requires some skin lightening agents at home. Very severe in-clinic procedures like a chemical peel or a Q-switch laser. If you want to know more about tanning, if you want to know how do you take care, what sunscreen to use, and how much of or which kind of a skin lightening agent suits you, please comment below. If you like this video, please share it with your friends and subscribe to my channel.